Thanks so much for joining us, Dr. Garcia-Romeu.
Hey, how are you doing?
I'm doing great. I am very, very excited about our conversation today. You have a wealth of psilocybin research. I was just looking at researchgate.net and it just went on forever. And I was like, wow, you have been in this for years and years. So I am very honored that you are willing to come on and share your expertise. So if we could start by discussing a little bit about how psilocybin works biochemically in the body.
Yeah, so psilocybin is a chemical that is just naturally produced in about 200 different kinds of mushrooms, and so they grow all over the world. And when we eat psilocybin-containing mushrooms, the liver breaks that down into psilocin, and so psilocin is a powerful psychedelic, and it is one of these drugs that we call a classic psychedelic, which means that a lot of the effects that are notable psychoactively speaking are due to agonist activity at the serotonin 2A receptor. And so when we ingest psilocybin, usually within about an hour, the body's broken it down and it's starting to have these mood and mind-altering effects, which we think of as largely mediated by the serotonin system.
Gotcha. And what are some of the conditions? I saw that there were a number of them, but we're going to talk about the conditions that have the most scientific backing behind behind psilocybin having a positive effect when taken for those conditions. So if we could start with alcohol use disorder.
Yeah, and I would really kind of break this up into three branches, I guess, if you will, and one of them being the addictive disorders, one of them being more mood disorders, and the other ones being more anxiety-related disorders. So obviously, alcohol falls under that first rubric of those, substance use issues, and essentially there is a large number of research participants who were tested using LSD for alcoholism back in the 1950s, 60s, and 70s. And once we had originally started looking at these psychedelics, they were very different than most of the medications that were being looked at that time. And the profile of effects were very unusual. And so as a result, people were not really sure how to administer this in a way that fit the prevailing medical framework at the time. But certain groups like Humphrey Osmond in Saskatchewan and others were really having a good success when they were administering high doses of LSD and related compounds like mescaline, for instance, for addictions, particularly alcoholism, in a sort of psychologically supportive environment. And so you could think of kind of medication-assisted psychotherapy where people would come in with a problem, like an alcohol use problem, and they would work with a therapist to try to examine their motivations for use, their problems with that substance. Where did that kind of stem from, and what did it look like at that time when they showed up, and where would they like to go in terms of setting some goals to get better. And within that kind of supportive framework, administering high dose drugs like psilocybin and LSD seem to really help people make some breakthroughs in terms of having greater insight into their alcohol use, and then also having more plasticity, maybe, if you want to call it that, in their ability to change their behavior going forward. And so that was really a big area of interest back in those early days of the psychedelic research. And as a result, Dr. Michael Bogenschutz, who's now at New York University, but was previously at University of New Mexico, has done some very promising initial research looking at psilocybin in this sort of psychologically supportive environment to help treat alcohol dependence. And his pilot study, which was published in 2015, in a small sample, it was open label, so there were 10 people, but they had 2 doses of psilocybin in conjunction with talk therapy. and found that the majority of those people were having significant decreases in their days drinking and their days drinking heavily, which are really good outcomes in the sense that they were seeing reduced alcohol intake and reduced problems around their alcohol use. And the nice thing about that is that this was a treatment that lasted in the ballpark of 2 to 3 months with a couple of drug administrations, but they're still seeing positive effects on alcohol consumption as long as, I believe it was 9 months after the final drug admin. So that's something that's kind of a hallmark feature of these psychedelic treatments, is that we seem to, for some people, be able to make these really profound, lasting impacts after just a few treatment sessions that can go on and have enduring benefits for months or years afterwards. And that's more like a surgery than a medication, if you want to think of it in a certain regard, because you have this intensive intervention that happens at a discrete time, and if all goes well, you're seeing improvements that go on, perhaps indefinitely afterwards, but at least, as far as we follow people out for several months. And with, Dr. Bogenschutz's work, he's now gone on, and I think there are maybe 60 or 70 people deep into a randomized control trial right now. So there's a placebo control. They're doing neuroimaging measures with people to look at the brain function that's related to all this. And I think they're aiming to get about 100 people all told. So this is, one of these larger early phase 2 trials that he's conducting at NYU right now. And I just came back from a meeting with Michael and a lot of our other colleagues in the field, and they're making great progress. And even though we haven't been able to see the final results yet, since the study is still in progress, we're certainly getting some very encouraging results at this point. So, that ought to be wrapping up in the next couple of years, and I imagine we'll hear more about the way that this has kind of turned out. But yeah, alcohol use, it's a big problem. I mean, we talk about the opioid use epidemic, or the opioid overdose epidemic, which I think at the peak was responsible for in the ballpark of about 60,000 deaths per year in the U.S., and alcohol is responsible for 88,000 deaths per year in the U.S. So it's, and it's legally available, it's accessible all over the place. So clearly a problem, and it's good to see that psychedelics are seeming to have a real positive impact on that when administered in the right setting, I think.
Yeah, and I really appreciate how you phrased it more as a type of surgery. You go in 1 or 2 times. It's not a thing you have to continue to take, like a lot of the other medications that we're used to in our current medical paradigm, and the effects keep lasting. Now, along that same vein, in the addiction center, cigarette smoking. It's been found correct. Psilocybin's got a great track record helping people with smoking cessation.
Yeah, and so that was actually a new direction that my mentor and my colleague here at Hopkins, Dr. Matt Johnson, came up with. So actually, if you look at all the different addictive drugs, I just mentioned the opioid epidemic, but tobacco kills more people than opioids, alcohol, cocaine. You put all the drugs together in one pile, and you still are just a fraction of the deaths and the illness that's caused by tobacco. And so, you have about 480,000 tobacco-related deaths in the U.S. per year, and that's 5 million around the world. And that's just each year that you have that many people dying from tobacco-related illness. So it's really a huge public health problem. And interestingly, just because of the way that the history kind of worked out, you didn't have the U.S. Surgeon General really coming out and saying, hey, everybody, smoking is dangerous, until about 1964, if I remember correctly. And that was around the time that you've got, psychedelics were quite prevalent then, but they were starting to become more taboo around that time because of their association with the counterculture. And by 1970, really, the bulk of human research with psychedelics was pretty much, on the deep freeze. And so there wasn't enough time of overlap where people were able to think, hey, what if we use these psychedelics to try to deal with tobacco addiction? So it took until 2008 when Matt Johnson decided to initiate a sort of a small pilot study here at Hopkins, where he decided really, to look at what would happen if you give psilocybin high doses in this, supportive context, use something like cognitive behavioral therapy, which is shown to have some benefits in helping people quit smoking, and then combine that with 2 or 3 high dose administrations, and just see how do people respond. Does it seem to help? Does it have any benefit? And actually, that was how I got my start, working in the field, because I had just recently completed my doctorate in psychology in 2012, and they were looking for someone who had an interest in both psychedelics and addictions, who would be able to kind of take on this project to finish it off, because it had kind of been languishing. A lot of people had been, helping out with it piecemeal, but nobody had been really focusing on it as a primary emphasis. So from 2012 until 2014, I ran a number of these smokers who were really motivated to quit. They were pretty heavy smokers, so they smoked on average about a pack a day for about, I forget the number of years. I think it was about 30 years that they'd been smoking a pack a day on average. So pretty hardcore smokers. They'd also tried and failed to quit on average about 6 times, 6 serious quit attempts in their life. And they were about 50 years of age, again, on average. And so we're talking about 15 people, so it's a small number of people, but it's enough to just see if there's a signal there. Is it safe? Did we harm anyone? Which are, some of our first concerns. And then if not, was it helpful? Did it do anything good for these people? And, we were really pleased to report in 2014, our initial findings were that, 80% of the people in that treatment quit smoking successfully, and they stayed abstinent out through this 6-month follow-up, which is kind of one of the major time points that groups like the FDA like to look at to see, does this, sticking? Did this really work, or are people kind of falling off the wagon? And we continue to follow these people out for a couple years afterwards, and we're still seeing at a year after their last psilocybin administration, 67% of them were abstinent, and about 2.5 years later, we're still able to find 60% of them were abstinent. So there really is effectively doubling or more kind of the success rates that you would see with some of the more traditional treatments, be it varenicline or bupropion or nicotine replacement, which are typically your first line kind of go-to smoking cessation treatments. And unfortunately, they fail for the majority of people. And so, we're very encouraged by, those pilot results to go ahead and do a larger randomized controlled trial that I've been working on with Matt and Roland and Elliot Stein at the National Institute on Drug Abuse for the last 5 years. And we're currently about 60 people deep into an 80-person trial. And, we're randomizing people to receive either 1 high dose of psilocybin or nicotine patches, and everybody gets the same cognitive behavioral therapy to help them quit smoking. And so far, we're seeing real good results again, and we're doing some neuroimaging as well to try to understand some of the underlying brain mechanisms there. But yeah, that's again to be continued because we are trying to finish that in the next year or two. And once we have all those data, and we'll be able to kind of publish our findings, and we hope continue to move this line of work forward, because it seems very promising. And there are obviously a lot of barriers to developing psychedelic treatments, but when you have such a huge public health burden that you're seeing from stuff like tobacco addiction, I think it really warrants thinking outside the box and trying new approaches. And if this continues to show that kind of high level of success, above and beyond what we're able to achieve with the available treatments, then to me, it's a no-brainer that we need to figure out a way to move it forward so that more people can access this kind of treatment.
Yeah, absolutely. Those rates are incredible. 60% at 2.5 years. Congratulations to you guys. That's a fantastic finding. And I read somewhere that you went back, and I'm not sure if it was the initial trial or somewhere after that, and you were trying to correlate the common characteristics with those who'd had success and the others. Can you talk a little bit about what you found?
Yeah, after we published that first paper, which basically said, here's what happened, here's what we did. We did this cognitive behavioral therapy. We gave people a few doses of psilocybin interspersed, and 80% of them quit smoking. And that was the kind of initial paper that we published. And those results were a little stunning because they were so good. And it was something that, I'd spent a lot of my time working on and trying to figure out, how did it work, or why was this working, was something that, I was losing sleep over. I mean, I knew that it was working, but couldn't put our finger on what it was. And even the people who went through the program would often, say that it was very difficult for them to put into words what it was that changed, but they knew something had changed and that there was something that had made it so that they were successful. So we started looking at some of the variables that we measured to try to identify what was it, where's the secret sauce? And one of the things that we had found previously out of the lab here was that people who had a particular kind of experience on psilocybin tended to show more robust changes in personality afterwards. And probably a branding mistake now, we realize now that we're 20 years into this the program here, but the type of experience that we call a mystical type experience is what seems to be one of the main differentiating factors in terms of the impact of the treatment. And so my colleague, Dr. Catherine McLean, had done some secondary analyses looking at our data with healthy volunteers. And a lot of the earlier work from the Hopkins lab was just taking healthy, normal people and seeing what happened when you gave them these high doses. And one of the things that happened pretty reliably, I'd say 60 or so % of the time, was that at the higher dose range, people would report these effects that we call mystical. And basically what that refers to is feelings of unity with one's surroundings or with the entire universe, feeling like you're transcending time and space, having feelings of deep positive mood like love, joy, peace. There's a sense of ineffability, so difficulty putting it into words, and so on. And so there are these core qualities of the mystical experience that people have been studying for years, both in kind of more religious studies, but also within the psychedelic research realm. And this goes back to Walter Pahnke's work and the Good Friday experiment, which is really some seminal work that they were doing at Harvard in the early 60s. We had a good measure of mystical type effects that we've been using at the lab here for years. And so I really took those data and sort of superimposed them across or compared them with, some of our smoking outcome data. And I did that across a number of different domains. And that included stuff like people's, confidence to abstain, which is kind of a subjective thing, obviously. It's sort of in your mind. But I also did it in urinary cotinine levels. So, I mean, just like psilocin is a metabolite of psilocybin, cotinine is a metabolite of nicotine. And it's one convenient way that we can measure how much or how little people have been smoking recently. And so we looked at changes in cotinine levels from the day that people walked in the door in our research study to about 6 months later. And we were finding that these actually correlated with people's mystical type experiences on their session days, or the level of personal meaning that they attributed to their experiences. So that has actually borne out across a number of different studies now, where looking at predictors of good treatment response, the qualities of the experience, of the psilocybin experience, seem to have something to do with that. And the more mystical type effects that people are having, the better kind of outcomes you're seeing, whether we're talking about antidepressant effects in people with mood disorders, or anxiolytic effects in people with cancer-related or other illness-related distress, and also in our addiction studies. So Michael found that intensity of mystical effects was correlated with decreased drinking in his work with people with alcohol dependence, and we found that as well in the people that we're working with who are quitting cigarettes. So that seems to be an important factor here, and it's still something that we don't understand 100%, but at least we're able to measure it, and so we can point to something and say that it's important, an important part of the process. It is a little bit of a double-edged sword, though, when you have people reading this type of work and then they're coming to our sessions, and because there becomes a strong expectation that people want to or must have this type of experience in order to get better, and we don't think that's the case. We don't want to confuse causation with correlation. We're seeing that mystical experiences are correlated with good outcomes, but I do believe that that's just one piece of the story, and that sometimes people have extremely difficult, challenging, frightening experiences and can still get a lot of real positive benefits from them, regardless of the content of their session. And so that's, again, still something we're trying to parse out and understand, but it just points to the amount of work we still have to do to really get a good handle on what's going on here. And we seem to be getting benefits, and positive effects in a number of different mental health conditions, but why that's the case and how it works exactly is still, jury's still out on that.
Yeah, I understand. And if we could move into those mood disorders like you were just talking about, both depression and anxiety, and then also if we could talk a bit about psilocybin's effect for end-of-life anxiety.
Yeah, and so that was actually another interesting area that some of the early researchers like Bill Richards and Stan Groff and these guys who were working at Spring Grove here in Maryland in the 60s, and some of the other earlier psychedelic research, a lot of which again focused on LSD, but this seems to cut across many of the serotonin 2A agonist psychedelics. And basically, the idea was that in these palliative care settings, depressed mood and existential distress, are big problems because these people are already ill. So they're, struggling with physiological problems that come along with that illness, whether it be cancer or some other kind of life-threatening diagnosis. But on top of that, you can kind of layer a certain level of psychological distress that really can impair quality of life, impair function. And so, people can get a little bit of what's the point, when they're in that situation. I don't blame them, knowing that there's sort of a expiration date, or that there's a fixed amount of time that you have left. And that's not an abstract thing, but, when you're actively battling something like cancer, it's very much in your face. And I think that, the idea was that perhaps using psychedelics could help alleviate some of that distress and help people kind of cope with their condition, and also help improve their quality of life in that way. And so some of that early work was promising, and we were able to do a study here at Hopkins. Dr. Charlie Grove over at UCLA did actually one of the earlier studies in the 2000s looking at cancer, anxiety, and depression. And Dr. Steve Ross and Tony Bossis over at NYU also did a sister study with us, where basically across UCLA, Hopkins, and NYU, you have a good number of people. I think it was approaching 100, might not have been quite 100, but who got some form of psilocybin treatment to try to help with their cancer-related distress. And, again, those results were really encouraging. What you're seeing is that after, a single administration of psilocybin in a psychologically supportive setting, these people were reporting, these ongoing benefits. There are reductions in anxiety about their condition, reductions in depressed mood, feeling like they're more engaged with the people in their life and with their life in general. And so, these were real improvements in quality of life that were measurable. They were statistically significant, and they were enduring. So they would go on, again, not just for duration of drug effects, which is 6 to 8 hours, but we're seeing this kind of continue 6 or 9 months out into the future. And so that really, again, kind of speaks to the power of these types of treatments, cutting across a lot of different kinds of conditions, but even in some of these situations that are very intractable for the most part, because a lot of the time traditional medicine might try to prescribe a antidepressant or anxiety medication to try to help in these types of situations, and those don't always work. And the idea is the pathophysiology of these conditions is somewhat different than what you would think of as an endogenous major depression, for instance. And so these people are facing basically a very real and substantial life challenge when they are at their end of life or when they're dealing with these really significant health problems. And so there seems to be something about the psilocybin experience or the psychedelic experience in general that can help people come to terms with that and have a better outlook on what's left of their life. And so that really seems to be another powerful area to move this type of work.
Yeah, absolutely. If this sounds familiar to people, this was just covered on 60 Minutes recently with some of your colleagues, I believe, were in that segment, and they had some of the study participants on talking about the substantial effects. So if anybody's interested, they should check that out as well for some firsthand reports. Can we talk a little bit about depression and anxiety effects that it can have on those who are not at the end of life?
Yeah, and so, we also seen in people who suffer from major depression. So that's a little bit different, as I was hinting at previously, but, it's a big problem. There's a lot of people on antidepressants. A lot of times those antidepressants can be hit or miss. Many of them have side effects that are not particularly well tolerated by some segment of the population. And there are people for whom many of these antidepressant medications don't even work, even after they've tried, a number of them. And so, again, this is a very serious public health problem. Major depressive disorder affects a large swath of the population at any given time. And it's also associated with other problems like suicidality, where we're seeing rising numbers of people, who are going through these types of problems. And so finding new treatments is really important. And there's so far just a few small published studies, but the ones that are out there really seem to hint at, again, these lasting changes in depressed mood that seem to go on for months after one or a couple of administrations of psilocybin. Actually, just came back from meeting with some researchers from South America who also has some great data showing antidepressant effects of ayahuasca. And so, that is kind of one of the big directions that you're going to see moving forward, is that people are working on these big phase 2 and hopefully soon to be phase 3 trials, where we'll be getting dozens or maybe even hundreds of volunteers who are suffering from major depression or treatment-resistant depression, and testing the efficacy of psilocybin to have some sort of lasting impact on that. And right now, there's 2 big groups that are working on these larger scale trials, but USONA is one and Compass is the other one. And we are here at our lab going to be one of the sites for the one of the USONA trials. And we also just completed a smaller study with psilocybin in people with depression, and so those results should be published next year. But they're very encouraging, and again, really, other than ketamine, which does have this rapid-acting antidepressant effects, we haven't really seen a lot of new breakthrough treatments for depressed mood over the last 20 years or so. Really, one of the last big ones was these, advent of these SSRIs. And even now, if you look at kind of the large-scale data, it's difficult to assess how effective they are really for people. They seem to have some small benefit for some people, maybe more benefit for others, but again, the side effects can be a problem. People have to take them oftentimes for months or longer. Some people report withdrawal when they get off of them or try to get off of them. So it's exciting to see the field kind of starting to acknowledge the therapeutic potential of psychedelics like psilocybin, ayahuasca, as potential treatments for mood disorders, and particularly for major depression. As far as the anxiety question, there's a lot of different kinds of anxiety disorders, and generalized anxiety is, a big one, of course. But there haven't been a lot of studies that are directly looking at psychedelic effects on anxiety outside of a specific condition like existential distress. But you are seeing some anxious type behaviors and ruminations that can improve in people, for instance, with obsessive compulsive disorder after administration of psilocybin. So Moreno and others did a study back in 2006. They published results showing that while people with obsessive compulsive disorder were under the influence of psilocybin, that they're having reductions in these sort of anxious patterns of thinking, desire to have these compulsive behaviors, and that's something that is continued to be studied now at Yale, and so there will be some new data to kind of continue to assess that. Another big anxiety-related condition is post-traumatic stress, and we'll be working on a new study here at our newly established center at Hopkins to look at psilocybin in treatment of post-traumatic stress, which I think will be huge since there's a big need there. And our colleagues at MAPS have done some incredible work just showing the treatment efficacy of MDMA-assisted therapy already in folks with PTSD. And so we hope to continue to open up the investigation now to look at some of these more classic psychedelics like psilocybin and see if that has some potential efficacy in PTSD or some other conditions that may have an anxiety-related component.
Yeah, that's really exciting. I love to hear that. I love to hear that all those are underway or about to be underway. Let's talk a little bit about, in all the studies that have taken place, have there been any significant negative effects from psilocybin?
So we do a lot of work on the front end to kind of ensure that we don't get a lot of bad effects on the back end. And what I mean by that is, we're extremely conservative and incredibly careful when we select people to be in these studies to make sure that we're not taking somebody who could potentially have a bad adverse reaction. And what I mean by that specifically is, we look to screen out people who either have, pre-existing mental health condition, and we're talking particularly about psychotic disorders or having had any significant history of psychotic symptoms in lifetime, because these are people that we have a strong suspicion may have a lasting negative impact from their experience, or at least they could be at greater risk. And so we've been very careful to go into people's life histories, make sure that we understand, what has their mental health been like over the lifespan, and screen out not only folks with these psychotic symptoms, but also with manic symptoms. And so there's also a concern that we could kind of initiate a manic episode in people who may have a predisposition. And so not only do we screen out folks with stuff like bipolar disorders or psychotic disorders, but we also screen out people even if they have first-degree relatives who have a family history of these types of disorders. And again, there's a strong evidence base to say that these are conditions that have some heritability. And so even if a person hasn't had any psychotic symptoms, if they have a first degree relative who has, that there's likely a basis biologically that they could have a predisposition. And again, we don't really want to play with those types of risks because not only is it unsafe for the people that we're talking about, but it could really set back the kind of the research on a grander scale, to have any of these severe negative adverse effects. So by screening people out, and then the other big piece of the puzzle here is making sure that we establish a good therapeutic alliance, a good working rapport with the person well before there's any drug administration. And so, people often will call us and say, I'd like to come to your lab and be in one of your studies, and I live in Indiana, but I'll fly out and do it over the course of a few days, and I come home and we spend usually about a month preparing a person for a psilocybin session, and that will typically take the form of several in-person meetings, usually with a dyadic team of guides or monitors who will be there during the session. We do a fairly intensive life review where we go over, major events in that person's life, important relationships, things that have had a important kind of lasting impact on who they are and their worldview. So we kind of understand them, from the inside, and that they feel safe and comfortable with the monitors who are going to be working with them in the psilocybin sessions. And I think between the careful screening, and that's psychological screening, but we also do physiological screening. So we screen out people with heart conditions. Psilocybin and the psychedelics can have some cardiac, effects, which could be problematic for people who have a history of heart problems. And we also look at other stuff just to make sure that, everything is a clean bill of health besides, the condition that we're studying for the most part. And that has seemed to work because we've done somewhere in the ballpark of about 700 psilocybin administrations here at Hopkins since 2000. And that's been in like 350 people. And we haven't seen, any of these really serious kind of adverse reactions. But what I mean by that is we haven't seen to harm anybody in the long term where they develop something like a psychosis afterwards and have to be hospitalized or something like that. We have, and actually relatively frequently do see people have what we call challenging experiences, which are kind of colloquially called bad trips. And that's not that uncommon when we're going at these high doses that we use in our sessions. And so, what that looks like really can vary from person to person and from day to day. But usually there's a strong feeling of anxiety during the drug effects. There's a strong feeling of fear. People might think that they're dying or that they're losing their mind. Those are some of the major ones. We can even also have some paranoia or some paranoid reactions where they think, we're experimenting on them in a way that it was not disclosed previously. So those are some of the, real risks that people do run when they come to these studies. But usually we've spent a lot of time preparing them for this beforehand. They feel comfortable with us so that we're able to sort of talk them through it. And, it's a testament to that because for every psilocybin session that we run here at our lab, we have a rescue medication box, which has a number of different types of medicines that we can use to block the psilocybin effects or to try to calm the participant down. And in those roughly 700 sessions, I believe we've used one of those rescue medications for psychological, anxiety once that I can think of. And the rest of the times that we have those challenging experiences, it's usually sufficient to be able to talk the person through it and to hold their hand and just to reassure them that this is temporary, that they're going to feel better in the short term, and the drug effects are going to be wearing off soon. And so usually that's, what we consider a sort of an acute challenging reaction, but that does not often lead to kind of ongoing problems afterwards. And in fact, many times people report that they feel like they've gotten some benefit out of this experience, even though it was difficult when it was happening. And I like to think of that kind of like if you've ever run a marathon or something, when you're in the middle of it, when you're in mile 13 or something like that, probably feels pretty hellacious, not a lot of fun. But, once you're through it to the other side, you can kind of look back and say, I'm glad I went through that, or, I got some benefit from that experience, even though it was difficult. So, those are some of the, difficult or adverse effects that we sometimes see. Like I said, sometimes we see spikes in blood pressure. So sometimes we have to administer medications to reduce that during the drug effects. But by and large, people are not, that we've worked with have not been harmed by even these very high dose sessions that we've been running for about 2 decades now here. And once we start to see this work branch out, and we'll see probably a lot more people coming into these larger scale trials, I think it will give us a better sense for what the safety is going to be like when it gets out into more medically accessible kind of situation where the screening may not be quite as robust or as careful. But my sense is that for people who are fairly, sound physical and mental health, these substances can be used in control settings in ways that are perfectly safe. And, that's kind of what the data point to at this point.
Yeah, well, thank you for that. I was going to ask in a related question, you said if they're having a difficult trip, then a challenging experience, then the monitor will help maybe talk them through it. If they are not, if they're just having a regular experience, do the people, the therapists that are in the room with them, is there any kind of discussion, or are they mostly monitoring?
So the work that we do is based on a model of psychedelic therapy that was really kind of made more prevalent in the 1960s in the US and in Canada. So there was, as I mentioned, a group here at Spring Grove in Maryland, Bill Richards, Stan Groff, as well as other groups like Humphrey Osmond, Saskatchewan. And without going into too much of the history, the school that kind of developed in North America using these extremely high doses was more of a therapeutic, non-directive school. And so the way that we do our sessions is really based off of that foundation. So during the sessions, we do very little in terms of interacting with the volunteer. Usually the first hour and the last hour are a little bit more intensive on that front, but there's not often any sort of agenda going in there. We just kind of, make sure people are comfortable and they're in a good headspace as this effects start to come on. During the period of strong effects, which is usually about 4 to 5 hours, we mostly ask that people lay down on a couch. They have their eyes covered with an eye shade. I think I have some here. So it looks like this, and they put them over their eyes. They're laying down on a couch. There's music playing both in speakers in the room, but also we have headphones. And so we really encourage people to go inward and to just kind of lay there and to see what kind of emerges in their mind. And so, we often tell people to trust, let go, and be open during these experiences. And, let us know if they start to hit some rough waters, because that's when it could be helpful for us to help them navigate out of that or through that situation. But if they're having a blissful experience of union with the universe at large, we try not to bother them, actually. We do have to take their blood pressure once every hour or something like that. But, we will check in occasionally. And if people kind of signal to us that they're doing fine, then we leave them be. And I think that from my experience, this is the optimal way to do this kind of work with high doses anyways. There was, again, the school that kind of focused more on doing talk therapy during the drug effects, and that was something that would be done with slightly lower doses than what we use. But I think that there's room for both of those approaches. But most of what's been done at Hopkins and elsewhere in the modern era does harken back to that model of psychedelic therapy, where we pretty much do a lot of the therapeutic work before and after the drug experience, and we try to be non-directive when the drug is on board for the most part.
Got it. That's really helpful for people who may be considering one of these trials, to give them. I love how you, for anybody who hasn't seen, who's listening to this instead of watching it, check out plantmedicine.org Instagram. I'm going to put up a picture of you holding up the eye mask, so for people to know like what they may be getting into. So thank you for sharing that. Dr. Garcia-Romeu, I appreciate everything that you've shared. This has been super enlightening. Can you tell people where they can find you and your center?
Yeah, our website is hopkinspsychedelic.org. And so that's our whole lab website. It's got me, Matt Johnson, Roland Griffiths, Fred Barrett, Nali Gukasian, Alan Davis, Mary Casamano. I mean, we have a whole team here that, many of whom have been working on this for a long time. And, it's an exciting time because we just had our center funded through the Stephen and Alexandra Cohen Foundation and Tim Ferriss and a number of other large donors who have made it possible for us to kind of take this work forward to the next step, where we'll be doing a number of new trials starting in the next couple years. I'll be leading the trial with people with depressed mood and early Alzheimer's disease or mild cognitive impairment. We'll be looking at psilocybin in people with anorexia nervosa. We've got other studies, as I mentioned, in the pipeline for looking at psilocybin in people with opioid use disorder, post-traumatic stress, and be looking at even combined disorders, which is not really something that's often done. Usually you try to get somebody who's just depressed or somebody who just has an alcohol problem. But Fred Barrett will be doing a really neat study where we'll be looking at people who both have alcohol use problems as well as depressed mood. And across many of these studies, we'll be taking a lot of biological sampling to try to get a better sense of who is, responding well to these treatments and perhaps who should not be coming into these types of therapies because it doesn't work for them, or it might produce some sort of difficult experience or some less than optimal results. So those are all questions that we'll be working on in the next several years. And so, people can certainly keep up with us at that website, hopkinspsychedelic.org. And it kind of will give you the layout there. So,
yeah, if they're interested in applying for any of those studies, same place, right? They can apply.
Pretty much, yeah.
Okay.
Yeah, that, and I always tell people there are people who get frustrated because they can't be in these trials because either they're they don't meet our inclusion criteria, they're not nearby. So another really good place to look for these types of studies, but really any studies, is clinicaltrials.gov. And so all of our studies will be on there. But if you have a condition, whether it be depression or alcohol or substance use problem, you can go on clinicaltrials.gov and really find what's being studied and what's being studied near you. And you may be able to connect with a trial that's looking for participants and potentially get help for a condition that might otherwise be hard to treat. So that's a very good resource as well.
Thank you. Thank you very much for sharing that. We'll be sure to put that in the show notes. And thank you for spending your time today and telling everybody this thorough recap on what's been done in psilocybin research and what is to come. So thank you again for joining us.
Yeah, my pleasure. Thanks for having me, and I hope you have a good one.
Absolutely. You do the same. And for everybody else out there, until next time.